Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating and rare case study that sheds light on an unusual presentation of cancer in a canine patient. This case, documented in the Journal of the American Animal Hospital Association, explores the diagnosis and treatment of an extraluminal leiomyosarcoma of the urinary bladder in a dog. Our story begins with a 9-year-old male miniature poodle who presented with acute and distressing symptoms including diarrhea, vomiting, and a noticeably distended abdomen. The dog's condition prompted immediate veterinary attention, revealing a large, firm mass in the caudal abdomen upon palpation. Initial diagnostic efforts included radiography, which indicated a substantial soft tissue mass situated in the mid-ventral abdomen. To further investigate the nature and origin of this mass, the dog underwent computed tomography, or CT, which showed the mass was in contact with the right cranial aspect of the bladder. The mass exhibited mild contrast enhancement and appeared heterogeneous, with Doppler examination revealing minimal blood flow. These findings were crucial in guiding the next steps of diagnosis and treatment. Surgical intervention was deemed necessary, and upon exploration, the mass was confirmed to originate from the urinary bladder. Subsequent pathological analysis led to a diagnosis of leiomyosarcoma. This particular case is noteworthy as the first detailed report of an extraluminal leiomyosarcoma of the bladder wall, complete with comprehensive imaging characteristics obtained through various modalities. To fully appreciate the rarity and significance of this case, it's important to understand the context of bladder tumors in dogs. Neoplasia of the bladder and urethra accounts for a small percentage of all canine cancers. Among these, the majority are of urothelial origin, while only a fraction are mesenchymal. Smooth muscle neoplasias, including benign leiomyomas and malignant leiomyosarcomas, are even rarer. Canine urinary bladder leiomyosarcoma, the type found in this case, represents a tiny fraction of primary canine urinary bladder tumors. The limited number of documented cases with detailed imaging findings underscores the value of this report. The diagnostic journey of this miniature poodle involved a series of advanced imaging techniques. Initially, abdominal radiography revealed a large, elliptical soft tissue mass, measuring approximately 11.9 by 6.6 centimeters, located in the ventral abdomen. This mass extended from the level of the 12th thoracic vertebra to the 7th lumbar vertebra. Its cranial aspect was situated caudal to the liver and stomach, while its caudal margin appeared superimposed with the urinary bladder. The mass displaced the colon and small intestines. Additionally, the radiographs indicated prostatomegaly, characterized by a triangular fat region near the prostate gland, urinary bladder, and abdominal wall. Ultrasound imaging further characterized the mass, revealing a smooth and well-defined margin, closely associated with the cranioventral aspect of the bladder. The mass displayed mixed echogenicity without cavitation, and color Doppler interrogation showed an absence of blood flow. Despite these detailed findings, the precise origin of the mass remained uncertain at this stage. The definitive characterization of the mass came from computed tomography. Pre- and post-contrast CT scans revealed a large, mildly heterogeneous mass, measuring 11 by 6.2 by 5.5 centimeters, predominantly located on the right side of the peritoneal cavity. The mass exhibited mild and homogeneous contrast enhancement, with a well-defined and smooth margin. It was intimately associated with the right cranioventral aspect of the urinary bladder, causing mild compression and displacement. The CT images also showed a concave appearance of the urinary bladder. While the exact origin was still not known, the images suggested the possibility of either a large urinary bladder mass or a peritoneal neoplasia. Based on these findings, the dog underwent an exploratory laparotomy 2 weeks after the CT scan. This surgical exploration confirmed that the mass originated from the cranial aspect of the bladder. The mass and the attached portion of the bladder were surgically removed. Histopathological examination confirmed the diagnosis of leiomyosarcoma of the urinary bladder. Post-surgical care included monitoring for hematuria, which was reported for less than 2 weeks. Encouragingly, the dog recovered well and showed no clinical signs of recurrence or metastasis 8 months after the surgery. This case contributes to the existing literature on smooth muscle neoplasia of the canine urinary bladder. A review of previous cases reveals that these tumors are relatively rare and have been reported in various breeds, predominantly in male dogs. The median age at diagnosis is around 10 years, aligning with the age of the dog in this case. The location and growth pattern of smooth muscle neoplasias can vary. Some masses are extraluminal, growing outside the bladder wall, while others are intraluminal, growing within the bladder. In this case, the mass was extraluminal. Imaging techniques play a crucial role in diagnosing and characterizing these tumors. Survey radiography can detect large extraluminal masses, while smaller masses, whether intra or extraluminal, often require ultrasonography, radiographic contrast studies, or CT scans for detection. Ultrasonography can provide valuable information about the location, echogenicity, and vascularity of the mass. CT with contrast enhancement is useful for assessing the size, location, and contrast enhancement patterns of the tumor. Clinical signs associated with urinary bladder smooth muscle neoplasias can vary. Intraluminal masses often manifest as urinary incontinence and hematuria, while extraluminal masses may present with abdominal distension and gastrointestinal discomfort. In this particular case, the dog primarily exhibited abdominal distension, likely due to the mass effect of the large tumor. Surgical removal, specifically cystectomy, is the primary treatment for urinary bladder smooth muscle neoplasias. Complete removal of the mass without ureteral reimplantation is often achievable, and long-term follow-up in previous cases has shown favorable outcomes, with many dogs remaining free of clinical signs and showing no evidence of recurrence or metastasis. The dog in this case had a similar positive outcome, remaining healthy and free of recurrence at 8 months post-surgery. The information from this case can be compared to what is known about smooth muscle neoplasia of the urinary bladder in humans. In humans, these tumors are also rare. Interestingly, leiomyomas are more common in women, while there is no reported sex predilection in dogs. In both species, these tumors tend to be solitary masses. Histopathologically, bladder smooth muscle neoplasias arise from the submucosa, with leiomyosarcomas infiltrating into the muscularis propria. Based on location, leiomyomas in humans are categorized as endovesical, intramural, and extravesical. While these categories are not consistently used in veterinary medicine, smooth muscle neoplasias in dogs are often described as intraluminal, extraluminal, or a combination of both. Ultrasound and CT imaging characteristics can also vary between leiomyomas and leiomyosarcomas in both humans and dogs. This case of canine leiomyosarcoma of the urinary bladder highlights the importance of considering smooth muscle neoplasia in the differential diagnosis of abdominal masses in dogs. The slightly irregular shape, heterogeneity on ultrasound, and absence of blood flow on Doppler examination can be indicative of leiomyosarcoma. On CT, canine bladder leiomyosarcoma may resemble leiomyoma, with mild heterogeneity and minimal contrast uptake. Recognizing these imaging characteristics can aid in the early and accurate diagnosis of this rare condition. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.